I'm Christy Butler, the manager of the Ambulatory Care Clinical Pharmacy Specialist with Providence Medical Group in the Oregon region. If you're watching this, I'd first like to thank you for your interest in our pharmacy positions. I'd also like to thank you for taking the time to watch this before we meet. With this recording, I will provide some background information about our health system, our clinics, and our pharmacy department and services. That way we can spend more time talking about your experiences and answering your questions about our program during your interview. So let's start with the 30,000-foot view. Providence Medical Group is part of Providence Health and Services. Earlier this year, Providence Health and Services and our affiliates joined with Providence St. Joseph and their affiliates and became Providence St. Joseph Health. This new organization is the third largest not-for-profit health system in the country, with 50 hospitals, over 800 clinics, 23,000 employed physicians, and over 100,000 employees, or as we call them, caregivers, and many other health and non-health care services. This is the geographic footprint of Providence St. Joseph Health, and though we are all part of Prov St. Joe's, as we've nicknamed it, each ministry still goes by its own name in their local area. For example, we are still known as Providence Health and Services. You can see by the map, by color distinction, that's how we are. So from here on out, we'll be talking about Providence, specifically the Oregon region. Within Providence, especially in Oregon, we are an open integrated health system, meaning that our hospitals, clinics, and health plan insurance company, as well as other clinical services, are all integrated and all have the Providence name. We're open in that patients with Providence Health Plan insurance may go to Providence or non-Providence employed physicians or hospitals, and our Providence clinics and hospitals may see patients with other insurances besides Providence Health Plan. So this leads to this sort of Venn diagram that I have going here. As part of Providence Medical Group, the ambulatory clinical pharmacy services collaborate a lot with the pharmacy services and other Providence ministries in Oregon. Within the Oregon region, we have clinical pharmacy services in all of these areas. So we work very closely with our 8 hospitals, our Providence Health Plan insurance, our pharmacists in home and community services, as well as our specialty pharmacy, Credina. We have retail pharmacies, and we newly and are expanding our presence into some of our specialty clinics. But the bulk of our time and of what our focus is going to be is the positions within Providence Medical Group. Geographically, we have clinics and therefore also pharmacists in all of our areas, and we grouped them into North, South, North Coast or Seaside, and the Columbia Gorge or Hood River. If you're not familiar with Oregon, here we are. North of us is Washington, south of us is California, and our clinics are represented by the dots on the map. We have a few clinics in the North Coast or Seaside area up in the left-hand corner, and one pharmacist there. We have a couple clinics in Hood River, and we don't currently have a clinical pharmacy specialist there, but they have pharmacists in the hospital who are doing some consulting work in the clinics. We have 7 or 8, depending on how you count them, clinics in the Southern Oregon or Medford area, and currently we have 3 clinical pharmacy specialists there. In the expanded Portland metro area, we have over 34 clinics. I think we're about 35 now, and we have the bulk of our clinical pharmacy specialists in this area. From the center of Portland, we go out about 45 to 60 minutes in pretty much every direction. As our department, as part of the medical group, the clinical pharmacy department is a non-distribution pharmacy service, meaning we're not really tied to any pharmacy products or dispensing. We provide clinical, educational, and operational support to all of the PMG employed physician practices. This is through a combination of centralized and decentralized services, and our goal is to promote effective, evidence-based, safe, and cost-effective drug therapy for all of our patients. Beyond the clinical pharmacy specialists within our department, we actually have several teams, and I'll go over them to kind of give you a lay of the land. But the rest of the time, we'll focus on the clinical pharmacy specialists that I manage. Currently, we have 19 clinical specialists in primary care and one clinical pharmacy specialist working with the proactive outreach team that I'll talk about in a little bit more. We have 4 PGY2 residents this year. In addition to our team, we have a team of pharmacists providing anticoagulation services and pharmacotherapy clinics. And this is a new expansion where these pharmacists will be starting to do management and monitoring of some other high-risk drugs. We have a centralized refill and prior authorization service to support our clinics. We have a robust medication assistance program, and we have a pharmaceutical and biologic support team that works with the medications and vaccines for the clinic. Our division director is Terry Bianco, a pharmacist, and she reports up to the Chief Medical Officer of Providence Medical Group, Oregon. Right now we have 4, and we are hiring a 5th manager for the different service lines. So we'll talk a little bit about now with this recording about the clinical pharmacy specialist roles, but this will be the bulk of the opportunity to ask questions and discuss in person. But to give you a little bit of an overview, we do a variety of things, the bulk of which is direct patient care, but we also focus on education, stewardship, and supporting our central services. Through our direct patient care, we provide collaborative practice management or collaborative practice agreements through office visits and virtual visits. And those are telephonic mostly, but we're getting more advanced in other new approaches using technology. We will provide comprehensive medication management with the really complex patients as physicians request. And we do consultations and drug information at physicians' request. We're also moving more and more into population health and proactive identification of patients to improve quality metrics, especially given the landscape of healthcare and the high amount of patients that we have shared risk or shared saving opportunity and responsibility for their quality performance. And we can talk about that more in person. In Oregon, we have very robust collaborative practice agreement laws. It does require a little bit of detail, but to alleviate any concerns, our agreements are guidelines and not algorithms. We have about a dozen disease states. The big 3 are bolded: diabetes, ASCVD, and hypertension. We also are doing a lot with pain, although this is a little bit more of a consultative role, but we've done some really impressive work with our patients on high-dose opiates to decrease the risk to them. The part of our collaborative agreements is that the pharmacists are expected and really required to have a lot of experience and training, and then that we are allowed to practice at the top of our scope using our clinical judgment. So we aren't seeing patients that fit into an algorithm. We tend to see the more complex patients and therefore need to be able to have the ability to meet the patient with wherever they are. Our pharmacists, from the very first slide you may have seen, have been part of the Providence Medical Group clinics for over 19 years. Now with Patient-Centered Medical Home, we have a very robust interdisciplinary team, and the pharmacists are very valued members of that healthcare team. One of the most exciting components of this team-based care model is the idea that all members are practicing at the top of our scope. And this is very true within Providence for the pharmacists. We're asked to do a lot of things that really our physician leadership recognizes that no one else is able to do. We'll talk about this more in person, but if you could do a little bit of math, you'll see that almost 50 primary care clinics and 19 pharmacists doesn't work out to have one pharmacist per clinic. So we have a couple of different models that we've done. Traditionally, one pharmacist would support, on average, about 3 clinics, depending on the size of the clinics and how many patients were there. But with some opportunities with being part of the Comprehensive Primary Care Initiative and now moving forward the Comprehensive Primary Care Plus program, our clinics are receiving additional funding to enhance the medical home team. And so some of our clinics have bought additional pharmacist time. And Some clinics have one pharmacist dedicated to their team. Other clinics have bought a little extra time, and so we have some sort of hybrid models where a pharmacist will spend more time at certain clinics and kind of traditional amounts of time at others. The education that we provide is not just to our pharmacy learners, although that is a huge part of our world, but we also are very involved in our provider education for our physicians as well as the ones in training. We have 3 medical residency programs associated with Providence. And in addition to our healthcare providers and staff, we also do a lot of patient education. This is a bit of an overview of everything that we've talked about. It outlines who we are and what we do, and giving our providers an idea of, we call this our menu of services. It gives examples of the type of consults and drug information, as well as examples of our collaborative agreements that they can refer to us. In addition, page 2 of our menu is opportunities for people and the clinics to add additional services as time might allow. We're very excited that this is the direction we're moving into more and more, with enhanced focus on quality, utilization, and safety. And then just briefly, our newest area of clinical pharmacy specialists is the involvement of a clinical pharmacy specialist in our proactive outreach team. This is a new team that was developed in 2016, and it involves case managers, social workers, and 1 pharmacist. And they are targeting the highest utilizing, highest risk patients with Providence Health Plan insurance. And they're doing home visits and really intense short-term management, a lot of transitions of care. And then they'll transition patients back to their medical team when more stable. I hope you found this overview informational, and I look forward to talking to you and answering any questions you have when we meet in person.